Every country is working to achieve universal health coverage. And universal health coverage is the situation where every citizen has access to quality, affordable care.
President John Dramani Mahama has announced that Ghana's newly introduced free primary health care policy is designed to shift the country's health system from a largely curative approach to a preventive one aimed at improving early detection and reducing long-term illness burdens. Speaking at the launch of the Shai Osudoku District Hospital, President Mahama explained that while the National Health Insurance Scheme has expanded access to affordable health care, significant gaps remain, particularly in rural and underserved communities. He noted that the current system often treats patients only after they fall ill, making it largely reactive rather than preventive. According to him, the free primary health care initiative is intended to address these gaps by strengthening preventive services, including routine health screenings and early diagnosis of diseases.
Every country is working to achieve universal health coverage. And universal health coverage is the situation where every citizen has access to quality, affordable care. In Ghana, we introduced the National Health Insurance Scheme, and it expanded coverage and affordability in a major way. But since we introduced the National Health Insurance Scheme, we still have a lot of pockets of underserved areas, especially in the rural areas. And so, for countries that want to extend the reach so that they can achieve universal health coverage, they include in it the primary health care aspect of it. With the health scheme, normally for most of the health facilities under the health scheme, you see the patient only when they are sick. And so it's mostly curative. One key aspect of the free primary health care is preventive, to identify the illness and get early treatment before it develops into something else. And so a major part of the free primary health care is the health screening aspect. And we are encouraging that when we roll out the free primary health care, our traditional leaders and our religious leaders will help us to mobilize their communities. At least every Ghanaian must be screened once a year. Every Ghanaian must be screened once a year. And you get the basic screening, and that includes hypertension. So the free primary health care post would have the sphygmanometers so that they can check your blood pressure to see if you are developing blood pressure. Sometimes if you are developing blood pressure, just a change of your diet can take it away. A change of lifestyle can take it away.
President John Dramani Mahama educated Ghanaians that unhealthy eating habits and increasingly sedimentary lifestyles are fueling a growing burden of non-communicable diseases NCDs in Ghana, including hypertension, stroke, cancers, and kidney failure. President said the country's disease profile is changing rapidly, with lifestyle-related conditions now accounting for a significant share of illnesses and death.
And so what are we doing? We are trying to prevent especially non-communicable diseases before they become complicated. Non-communicable diseases have become the heaviest disease burden in Ghana. Breast cancers, cervical cancers, hypertension, strokes, cardiovascular accidents, and renal failure, kidney failure, they've become the highest disease burden in Ghana because of the change in our lifestyle. And so one of the aspects of the free primary health care too will be to educate people on what makes you susceptible to non-communicable diseases, how to change your lifestyle. I mean, if you are the kind of person who likes eating heavy foods, you are not physically active, you are sitting in one place, and yet when they give you your fufu or banku, you say it's too small. You want a big bowl of fufu, and you want to eat it every day. Sometimes you eat it at night before you go and sleep. All those dietary changes you'll be educated on. Please, by 7 o'clock, eat your dinner and don't eat again. If you are hungry, just take some cup of tea or something. Don't eat any heavy food. Banku in the evening, you come from work in the evening, and then your poor wife is tired. Come and do banku, come and stir banku for me at 10 o'clock in the night. Why? So, an aspect of the free primary health care will be education on how to maintain a decent lifestyle. Our fathers and co used to eat banku and fufu late in the night, but they were physically active. They used to go to the farm, and they expended energy. Now we don't do any physical activity.